Molweni guys. Mokgotsi, I got it. I decided to let me in between my hectic schedule quickly prioritize to actually answer this, because you're not the first. So many people asked before and I feel like guilty to I meant to actually answer this that time when people were actually were writing and applying. But anyway, I guess it's never late. Let's just do it anyway. Siyazge length motivation it shouldn't be longer than 2 hours, 2 pages. First of all, so I'm just gonna take you through quick. You are motivating to get into the public health space, right? So number one, your introduction. I need to you know how to write a formal letter. There's what is subject, motivational letter for Ngoma for this particular degree. So now we're going to go to the first paragraph. First paragraph, you introduce yourself. You introduce the purpose. This is your current qualifications and the professional identity. For instance, Mina, I work as currently I don't want to talk about myself. Anyway, I'm an executive in industry, in a pharmaceutical industry, but my professional identity is being an epidemiologist. So I remain an epidemiologist, doesn't matter what I do and how, right? So I would briefly introduce myself and my qualification and my professional identity, right? That's your title. I'm an epidemiologist, even though currently I work as whatever that I work as. And brief statement on the interest in public health. Remember, you said you are writing this particular motivational letter to join a public health space. So why are you interested in public health? When I went, now I'll speak about myself. I was a clinician, particularly in obs and gynae, although I was rotating rarely a casualty, but I was stationed 24/7 in obs and gynae. My calls were also in obs and gynae as well. More obstetric than gynae actually, but yeah, you know what I mean. Level 1 hospital is mainly obstetrics, maternity. So I was a maternity babe ever since, right? But when I went into public health, I had to indicate how do I leave clinical med to public health, because those are two distinct worlds, totally distinct. At clinical med, your patients are individual patients. As you see, you can calculate and count to bona by 15 elang, right? But in public health, it's multitudes. Your patients are populations. Your patients are governments. Your patients, it's population at large. Everyone with HIV, everyone who's on PrEP, for instance, everyone with malaria, everyone globally with that particular disease, or at a certain setting, low to middle income countries, for instance, with that particular disease. So there's that shift here, population lens compared to individual lens. So you need to motivate how are you now wanting to join public health? What triggered that? So that they can see, well, you know what public health is about. By the way, public health, we know it's mainly about preventative care, while clinical medicine is about curative care. Clinical medicine, we are curing diseases, we are managing emergencies. You are on your feet, you are addressing the problems that already occurred, while in public health, we more like preventing these problems, these health events from occurring. There's that distinction as well. With your patients are population compared to clinical meds, when your patients are individuals, the approach is more preventative care compared to curative care, and you are monitoring we run disease surveillance. Unlike when we see patients in one hospital, now we are running disease surveillance for every hospital in South Africa or in Africa or in the whole world. We have disease surveillance per region like that, and they know that hierarchy. With that information, you can see as we are treating at an individual level patients this much with this drug every day, does it work or not? And we're gonna inform now the clinical med this drug works or it doesn't. Now we need to introduce new drug. Now we need to introduce new intervention, this and this and that. So you need to show that you understand this really distinct approach in these two worlds, because clinical med totally different from public health. So that's why you're going to introduce yourself and your qualification, and then you're going to link that in your interest with public health and briefly describe interest. Yako will describe uyayazi what public health is. Core motivation, population health or systems impact. We deal with policies, we deal with guidelines, we're researching, prevention focus. Core motivation must always talk to exactly this. Population health, preventative care, policy, health policy, health system strengthening, prevention focus. That is your core motivation, right? You're going to link it with the clear statement of applying to the MPH program. So this is your first paragraph. As much as you introduce in the first line yourself and your qualification and your professional identity, then you're going to move on to describe your interest, what triggered you, why you're interested in public health. And that story, as you align it, you're going to link it exactly the motivation and as well as a clear statement of you applying for this MPH, right? Whether MPH or MSc, that's your first paragraph. I mentioned 3 bullets: qualifications, professional identity, your interest in public health, and the last sentence in that paragraph is going to be a clear statement of applying for this MPH. Then you move on to paragraph 2, academic foundation, really, undergrad degree and institution, ufunde phi kanjani, relevant coursework. You like myself, I started with IT, guys. I'm actually an IT engineer, if you didn't know. But I never even talk about it because it's never relevant. Manje, at my space, well, I talk about clinical med a little bit because it's linked to my industry now. But when I was an AP, especially a field AP, it was not very relevant. So you pick and choose what's relevant for each position or for each space, right? Because your CV will be so rich, but you don't talk about everything. So pick and choose. Paragraph number 2, you're going to talk about your academic foundation and background, undergrad degree in the institution you studied, and the relevant coursework. It must be something linked to epidemiology, biostatistics, research methods, or community health. Those type of public health related work. If there is, you only speak about that. You don't have to talk about if pharmacology is correlated upper, or medical terminology is not related here, or anatomy, physiology is not related much here. You're gonna pick and choose those aspects of your degree or your academic background that is linked to public health. You can briefly speak about that. Academic strengths. Now your academic strengths that actually make you a best candidate for public health. This talks to number 1, you gotta be analytical. You can't separate being analytical with public health. You gotta be analytical. You gotta be you gotta have a research exposure. We know when you're specializing, when going to your masters, you need to have worked. You need to have exposure in public health. You need to have exposure in research, right? And it clear distinctions of. I mean, like myself, I did say I was in clinical med, and how did I get here? I mean, I was introduced. I don't want to talk about myself if it is or pale. So you're going to talk about that, undergrad degree, relevant coursework, academic strengths, and research experience. Go publish. Are you part of publications? What are your contribution in any publication? We are a co-author, we are a collaborator, or we are part of this and this publication, audits, our projects, quality improvement projects that worked for me actually because with clinical med, at least we did those and they work best for me. Depends what kind of like research exposure you have. You're gonna speak about that. Moving on to paragraph number 3. By the way, before Ngula, I counted 4 bullets. Undergrad degree and institution, relevant coursework, number 2, academic strengths, number 3, number 4, research experience. That's your paragraph number 2. Running to paragraph number 3, I'm running out of time. Professional field exposure, here, good, this paragraph. So we're going to talk to clinical or healthcare work experience. It's fine, even through your undergrad degree. Exposure to health system gaps and inequities. This works for you. Public health, we are about solving systemic problems. We are not about solving minor things. So you're going to talk about health inequities. We know that South Africa is one of the most unequal countries in the whole world. You're going to talk about your exposure to these health inequities because this is mainly the driver of why we want to join public health and we want to solve problems at a scale, systemic problems, health system strengthening and all of that. So we want to see you talking about that. Experience with underserved or high burden population. Hey, please tap on this. Now this is a scope. Leadership and program involvement and project coordination. What have you at your own capacity contributed in this? And data use, audits, diagnostics, or quality improvement involvement. Yeah, so these are the 4 points for paragraph 3. We gotta go to part 2. Askis.